So, welcome back. If you've just joined us, this is Good Morning Nigeria and it's live on the network service. We told you February 27 made it 2 years when Nigeria received coronavirus via the Italian who landed at the Murtala Mohammed International Airport in Lagos, went to Ogun State and left bits and bits of the virus. And then, of course, gradually it spread, and then into community spread. It's 2 years now. We have vaccines. Some of us have taken the first dose, second dose, booster doses, but we are still, conscious or concerned about the virus. And we're being warned that it is not over yet. But what have we learned? Is it a clean bill of health? Where are we going from here? Let's listen to this backgrounder quickly put together by Oyeyemi Ajayi.
News about coronavirus was first heard in faraway China in December 2019. It was later spread as the purveyors of such news soon discovered it was mutations found expression in different modes of transmission in other countries and continents in America, Europe and Africa the following year. During this time, Nigeria had put up preventive structures and measures as precautions, especially for inbound travelers, to ward off recording any case as all got weary of what the virus was all about. However, on the 27th February 2020, Nigeria recorded the first case of COVID-19 in Lagos. The number of cases rose to different levels, thinned considerably at a point and shot up, giving rise in the different parameters in the state's monitoring methods. Still, the worries and fears were on for many, knowing well the impact and effects of the virus on human lives and mobility, the mutating ability and nature to break down the immunity of its host and bring to death. For almost a year, the virus tagged a public health emergency of international concern by the World Health Organization operated freely as there was no known vaccine, drug and antivirus produced to tame it, except for the simple pharmaceutical protocols of hygiene, washing of hands, keeping suitable distance with others, to the use of alcohol-based hand sanitizer, amongst others. The Nigerian Center for Disease Control, NCDC, became the lead agency for the multi-sectoral coronavirus preparedness group, aside a presidential task force led by the Secretary to the Government of the Federation, Boss Mustafa, to champion the sensitization of Nigerians and create necessary awareness on the dreaded disease and the federal government's efforts at containing it. The country's health system was seriously affected as many victims were hospitalized, resulting to the straining of hospital beds, though many died, including the first-line attendants, the medical doctors, who had contact with the patients. Nigerian government, on its part, took full responsibility of protecting its citizens by mandating the social distance policy, which includes 50% gathering at every point, especially at religious gatherings, vehicles, amongst others. There was also the lockdown, which was later relaxed. Within these 2 years of the ravaging virus, some Nigerians talked about some local concoctions with the capability of fighting the virus, but the Ministry of Health debunked it, saying they aren't effective enough to kill the virus. There was a little breakthrough when the anti-COVID-19 vaccines were produced, which was said to have over 90% efficiency, but still with the basic health precautions being activated. Throughout the pandemic period, Nigeria had experienced 4 different waves of the virus and has overcome. As at the end of February 2022, less than 50 new cases were recorded daily. These low records could be attributed to efforts of the government's rolled out measures of vaccination, which has yielded good results of protecting the citizens. So far, how can the government's approach against COVID-19 be assessed? What more can be done to ensure the end of the virus? These are some questions guests already seated in the studio will be answering shortly.
All right, thank you very much, Oyeyemi Ajayi, for that backgrounder. Dr. Ifedayo Adetifa joins us for this conversation and is joining us via Zoom. He's the Director General, Nigeria Center for Disease Control, NCDC. If we can have Dr. Ifedayo Adetifa, he's joining us via Zoom. And of course, yes, that's Dr. Ifedayo Adetifa, DG, Nigeria Center for Disease Control. Thank you very much for joining us, Dr. Adetifa.
Thank you for having me, Claire. Good morning.
Yeah. Also joining us via Zoom is Dr. Vivian Quarre, and she's head of Infectious Diseases Unit, University of Abuja Teaching Hospital, Gwagwalada. She's also joining us via Zoom. I hope she can hear us. Dr. Quarre, thank you very much. Good to see you.
Good to see you too. Good morning, and thank you for having me.
Okay, we'll just get to you in a short while. Let me quickly introduce the guests we have here in the studio. Dr. Mukhtar Mohammed is Head Technical Secretariat, Presidential Steering Committee on COVID-19. Thank you. Always a pleasure to have you with us.
Good morning, Claire. Good morning, Nigerians.
All right. And Dr. Basi Okposen is here again. Of course, we saw him in our last conversation. Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Thank you very much, as always.
Good morning, Claire. Good morning, Nigerians.
Okay, Dr. Adetifa, we're starting straight off with you. Let us know, it's 2 years, and the NCDC has been in the forefront of, trying to steer this pandemic away from us. Give us a sense of, what's the situation now, 2 years after?
Well, I think it's important to remind us that the COVID-19 pandemic is unprecedented. It has and continues to be a once-in-a-lifetime event. Unlike most of the outbreaks that we're used to, this was not just a problem for health, but it also significantly affected livelihoods, economy, including things like travel and social interactions. The earlier background material talked about lockdowns. I don't think anybody around in this lifetime has experienced lockdowns on the account of a disease outbreak other than usually what you typically experience with security situations. So given that description, it definitely required a major redirection of our public health resources, which for the first time in my lifetime at least was focused on fighting one disease, and one disease that we knew very little about at the beginning. But there were a few positive things. It's that while the pandemic provided the opportunity for us to build as we responded to it, because it was clear that if the world, including Nigeria, had been better prepared for this pandemic, maybe the trajectory would have been different. So it highlighted the need for us to all invest more in pandemic preparedness. And the investment in pandemic preparedness as part of this response is one area where I think we have made significant gains, and the country has done well relative to the scenario that we had before. So right now, we're in a good place, is what I would say. And that's because we've got vaccines, we've got diagnostics, we have public health safety measures, and we know that all of these work. Of course, the big factor to consider is whether people will adopt or adhere to these measures. And all of these measures work regardless of which SARS-CoV-2 variant is circulating. Do we know whether we have come to the end of coronavirus or COVID-19 pandemic? We do not know. This virus is new. We have managed to gain a lot of knowledge about it in the last 2 years, but we do not know everything about it. We may yet be surprised by another variant that may have immune escape mechanisms or be more virulent. We hope not, but the attitude as part of preparedness is that we prepare for the worst and we hope for the best. Back to you, Claire.
All right. Thank you very much, Dr. Adetifa, there for your opening comments. Let's also bring in Dr. Vivian Quarre into the conversation. She's of the University of Abuja Teaching Hospital in Gwagwalada. Dr. Vivian, of course, we can see you there on the right side of the screen. At the height of the pandemic, we had you as our guest, often remotely, as we are doing on this occasion, discussing with us. And I do remember that at some point, you and your team had spent about 6 weeks at around your hospital without leaving, without going to be with members of your families. Could you just summarize for us what the experience was like or has been like in dealing with this very unusual pandemic, and your hospital being, as it were, a major center in handling some of the cases?
Thank you very much for having me once more. Just like Dr. Adetifa has mentioned, it's once in a lifetime experience for everybody, even for us here at the University of Abuja Teaching Hospital, dealing with an unprecedented infection. I really thank God for the privilege of being one of the response, being part of the response team to COVID-19 in management in Nigeria. And it's an experience that I believe will impact positively on my career as an infectious disease physician. And it came with a lot of challenges. The onset of the pandemic, the facilities were being prepared to receive the patients, equipments were being brought in, consumables were being purchased, were being moved into the facility. As a doctor, one of the questions I asked myself was, if I'm face to face with a patient that has COVID-19, what will I do? I mean, there was no protocol anywhere. WHO had not come up with any protocol for management of patients with COVID-19. I couldn't find anything in any textbook on how to manage a patient on COVID-19. I remember sitting down in our call duty room, and I picked a piece of paper and called my colleagues. Let's come up with a protocol. I mean, that was a major challenge. Let's come up with a protocol on how to manage this patient. When we are face to face with a patient, what should we do? What kind of contact should we have? Taking into consideration the fact that we're dealing with an infectious disease, yes, we want to render help, but we also need to protect ourselves. So how much contact should we have with the patient? What kind of physical examination should we carry out on a patient that has to bring up a protocol or a guideline on how to manage a patient with COVID-19. And we did that also for the nurses. As a nurse, and with a patient that has COVID, that was done. The next challenge we faced was that of the fear of being infected, with this virus. That fear was quite palpable, as everybody else was, running away from COVID-19 patients, and we had to manage these cases. So we were afraid of being infected. We didn't know what to do. Yes, we were giving the protective equipment, we had the gloves, we had the face masks, we had the PPEs, but then we were seeing healthcare workers in Europe, in the US, with all those equipments being infected and even dying from the virus. So it became apparent that these equipments or these protective gears did not confer 100% protection against the virus. So, I mean, being a Christian, I didn't know what to do, but to go back to the Bible. And I remember writing down Psalm 91, and then reading it out to myself every day before going to the isolation center. Reading out Psalm 91 every day before going into the isolation center to manage these patients. And I remember trying to, preach the same gospel to my colleagues. Of course, it's a matter of faith, and we all have different faiths, and people handle it in their own ways, but we all looked for a way to manage this fear of being infected by the virus. And then we had the challenge of stigma, which was very, very palpable. Nobody wanted to even go close to us. It was so funny, because even our own colleagues, were stigmatizing us, and our family members were also stigmatizing us. And that's the reason why we couldn't go home, at least for like the first 6 weeks of, working in the isolation center. I remember our medical director had to get a place for us, a hotel opposite the hospital where we stayed for a period of for about 6 weeks, because we couldn't go home. Our neighbors, our family members were afraid of getting, close to us, because of fear of this deadly virus that we had. In terms of materials to work with, we didn't have much challenge in that area, thanks to the Nigerian Center for Disease Control, thanks to the NNPC, the Federal Ministry of Health, the Mainstream Energy Solution, and many organizations and groups and individuals that came to our help. They brought in a lot of consumables, that helped us. And I don't remember at any point in time lacking any equipment to work with. I know it's not the same thing with people working in other centers in Nigeria. They must have faced some challenges of lack of materials at one point in time, but that was not our experience here at the University of Abuja Teaching Hospital. And then we had the challenge of, burnt out, fatigue, exhaustion, particularly with the second wave and the third wave, because we saw so many patients, so many sick people. At one point in time, we had over 40 patients on admission, taking care of these people, seeing people dying every day. It was a whole lot. It was a whole lot to deal with. And by and large, I would say that it has been a wonderful experience, very challenging, but very wonderful. And I would cherish this feeling. I would cherish all that I have learned from this pandemic for the rest of my life.
All right, thank you very much, Dr. Vivian. Maybe you have your memoirs, ultimately, let's say, memoirs on coronavirus, or my COVID-19 memoirs. Thank you. But let's bring in Dr. Adetifa one more time. That's the DG of NCDC. Obviously, I mean, it will take quite some time to review some of the lessons that we have learned from the relatively fragile healthcare system that we had to an explosion, if you like, in testing facilities, laboratories, and so on and so forth, and the various lessons that we have all learned. But two things that I would like you to tell us, that's our viewers now. What are the numbers? There were complaints that, one, we were not testing enough, and which is why the numbers tended to be low. How many Nigerians got infected from those that were tested? And how many fatalities did we have? But arising from that, how did we escape the doomsday prediction that Africa, including Nigeria, of course, was going to be a graveyard for victims of COVID-19?
There's a lot to unpack in those questions, Kingsley. Let's start with the second part, which is, how did we escape the doomsday prediction? I think the summary answer is we do not know. Okay, but we think that there are a few things that have contributed to that. Of course, there's the demographics, which is the population structure in Africa, which is much younger. I think what is clear in terms of the risk factors for adverse outcomes for COVID disease, whether you're in the north or in the southern part of the world, there are some shared risk factors, and age is one of them. So even in Nigeria, for the number of deaths that we have had, sadly, most of those deaths have been in the elderly, have been in people with comorbidities, and the like. So we've got those shared risk factors. It just seems like, compared to many populations in many countries in the West, we do not have such a large population of people like that in our demographic structure. Our country's populations are much younger not like, the example in Italy and Spain, where almost 20% of the population is above 65 or above 70, depending where you put the cutoff. So that's one thing. In terms of the lessons learned, obviously, I think the world in general realized that we were poorly prepared for this pandemic, despite the fact that for years we have been talking about pandemic preparedness. But the case in Nigeria and many countries in Africa was that, yes, the state of preparedness and the ability to respond to these types of conditions, we were badly unprepared. But with, I think the good thing is that we rose up to the challenge as quickly as we could. In fact, before the first case was identified in the country, the NCDC already had, and partners already had a preparedness plan, already had an action plan in place, which was costed and which the government and other partners had already started to implement. But obviously, the scenario is such that you are caught in a storm where you have no house. At the same time, you had to build a house to protect yourself from the storm. That's the scenario where we found ourselves. So that's a very challenging situation to be. But as you said, we went from 3 laboratories with molecular diagnostic capacity to a full network of laboratories across the country. The country invested in treatment centers, in isolation centers, in intensive care units, in laboratory capacity. And I think what these, although not perfect, these actually mean that we're in a better place now compared to 2 years ago at the beginning of this pandemic. And we need to remember that it is a flu pandemic that was being expected, not a coronavirus pandemic. In fact, this is the first time in human history that a coronavirus has been responsible for a pandemic. So we need to keep in mind that we still may have a flu pandemic, and therefore the work is not done. In terms of testing, yes, as we know, in the context of the pandemic, we went from an unknown cause of pneumonia was reported in November or so, 2019. The world had to scramble to develop tests to identify these conditions, this particular pathogen, and to validate and do all of that. That took a bit of time, but that also meant that because we couldn't do that ourselves, we were dependent on other people to do that. But through the work of the African CDC and the African Society for Laboratory Medicine, testing was quickly made available on the continent and ramped up. But in terms of our testing per capita, or per 100,000 population, we did not manage to reach the desired levels. However, we have been able to test consistently a steady number, such that that number was enough to signal to us any changes in the trends or in the patterns of the disease, even without reaching the desirable levels of testing. The other thing to remember is that most cases, even in places where testing was really high per capita, because a significant proportion of people infected with SARS-CoV-2 are completely asymptomatic, the disease estimates were still significantly underestimated. And we know that even in Nigeria from our serology studies, this is studies where we take blood samples from people to look for antibodies that have been developed in response to exposure to this virus. And we know that depending on what time point you look at, a lot more Nigerians had come across this virus and developed antibodies to it than are represented in the test numbers. And a lot of these Nigerians, when you ask them, have zero recollection of being sick or being ill. So that also doesn't help the situation. But the lesson learned is, well, we can ramp up testing. Should we have a pathogen that requires, that leads to a lot more cases and burden on the healthcare sector, we will need to be able to test at a much higher level than we did from COVID. And this is one of the lessons that I learned. I'm sure you will ask me plans going forward, but there are other lessons learned that we will need to talk about, and we will need you and others to hold everybody accountable to make sure that we just don't go to sleep when we think COVID has gone and then wait for the next fire outbreak before we start responding. Back to you, Kingsley.
All right, Dr. Adetifa, thank you. Just before we let both of you go, I'd just like to hear the perspective of Dr. Vivian Quarre on the behavior of Nigerians now, 2 years on, in terms of compliance with the non-pharmaceutical and pharmaceutical rules and regulations.
Hello, yeah, thank you. Thank you. Well, for now, many people think that COVID is gone. In fact, even during the heat of the pandemic, many people didn't even believe that it even existed in the first place. I remember somebody calling me and asking me why I had not attended a meeting. And I told her, I've been at the isolation center. I'm working in the isolation center. She said, what are you doing there? I said, we are managing COVID cases. She said, COVID in Nigeria? Is there COVID in Nigeria? So many people didn't even believe that the disease even existed in the first place. And so, of course, they didn't comply with all the measures that have been put in place, i.e. putting on face masks, social distancing, and all that. And now that the number of cases have actually gone down significantly, people have thrown caution to the wind, and you see people in large gatherings and nobody is putting on any face masks at all. In the marketplaces, in our churches and the mosque, I don't see anyone except in public places where people still put on face masks and they observe these protocols that have been put in place. Nobody is doing anything. So I think we still need to continue to educate the people. I don't think COVID is over yet. We cannot throw caution to the wind so soon, and we still need to continue to educate people to continue to adhere to these measures until I think we receive an official, maybe official notice from WHO that the pandemic is over before we can let loose our guard. Thank you.
Vivian Quarre, Head of Infectious Diseases Unit, University of Abuja Teaching Hospital, Gwagwalada. I'd like to thank you and thank God for your life as well as those of your colleagues. And thank you very much once again for all the good work that you have done. Thank you.
Thank you very much for having me.
Let me also appreciate Dr. Ifedayo Adetifa, the DG of the NCDC, also again for your contributions to our program.
Thank you very much, Claire.
All right, so we'll take a short break. We'll come back.
That's was caught off guard there. We just tried to make, if you like, a checklist of some prominent Nigerians, who succumbed to COVID-19. At the time, people were engaged in denial. I mean, prominent persons, I doubt if there's any Nigerian today who doesn't know one prominent Nigerian that succumbed to COVID-19. Back to the studios, Dr. Mukhtar Mohammed, Head of the Technical Secretariat of the Presidential Steering Committee on COVID-19. Well, we're doing, if you like, now like a post-mortem, 2 years of COVID-19 in Nigeria. But strictly speaking, can we discuss COVID-19 in the past tense or in the present tense or in the present continuous tense?
This is a grammar lesson. Well, I think looking at the totality of the situation, I think we can refer to some things in the past, and we can certainly discuss the things that are happening currently, and we also have the opportunity to view it in the future. Looking at the past, we'll talk about, when the epidemic started. Initially, it just a faraway land, from Africa. But within a short period of time, the disease has spread through Europe, and to all parts of the world. So we can look at it from that perspective. to say that, yes, when it started, we didn't know much. When it started, there were no drugs. And as Dr. Vivian mentioned, even there were no guidelines. There were no vaccines. The health community didn't know exactly what to do. We have a general idea about prevention, what you need to do to protect yourself, the information you need to provide to the public, but we did not have any definitive knowledge about how the disease was, the course the disease was going to take. So that is it. Currently, yes, COVID-19 is a reality, and we've seen how it has devastated our health system. We've seen how it overwhelmed some of the health systems in other parts of the country. We have seen how partnership, collaborations, and efforts from various sectors of government have been brought to bear on the disease. And we know that all these measures have worked. And currently, yes, we're beginning to see a marked decline in the number of cases. Globally, we tend to understand much better the epidemiology of the disease, and we're now looking into the future to look at what does the world need to do. We know that geographic boundaries are just arbitrary, they are not physical boundaries, and the disease in one part of the world can actually be in another part of the world within a short period of time. We also understand that our collective, will to be able to fight diseases everywhere is what will help guarantee the safety of public health globally. We know that global health security, looking at our total biosecurity, is important, and therefore it's important for us to design programs, public health programs, that will safeguard individuals, will safeguard families, communities, and will safeguard nations as well. We need to take into cognizance, our ability to manage, the data we are getting from testing, the DNA testing that is being done. You had Dr. Adetifa mentioned that we moved from 3 laboratories now to over 120 laboratories in the country. And so we're generating a lot of data. We need to open up our research frontiers. We need to make sure that we improve our capability for production of vaccines, because this is going to be a long haul. In the end, collaboration between different countries is very important, and we need to establish that framework such that all countries would be able to, move together and make sure that we are our brother's keepers. If you find an epidemic in one point of place, it's good to ensure that, it is controlled before it spreads to other parts of the world. So I think in summary, this is what I will say regarding past, present, and also the future.
All right, thank you, Dr. Makar. Let's bring in Dr. Pusa here. I have 2 questions. I'll try to make them as concise as possible. The first one is, you heard Dr. Quarre. He says that it's like Nigerians are letting down their guards. Would it be that the health authorities in charge of sensitization are also letting down their guards? That's one. And 2, the doom prediction was probably based on maybe the health, capacity of our health systems, and which was described as weak. In the event of any outbreak of such, because it says we don't know, the next phase of, is our health system now, has it been strengthened? Is it better than before?
Okay, I think I will start from this way, right from when we were young till today, and we'll continue to say it. Prevention is better than cure, easier, cheaper. Now, when you look at the COVID pandemic itself, what is responsible for the letting down the guard? Because from the government side, I want to say the government is not letting down its guard. But from the public side of it, from the very beginning of the pandemic, most people didn't believe. Till today, there are some people that don't still believe that there's COVID, and it's unfortunate. The truth is, COVID-19 is real. Like Isley mentioned earlier, we all know loved ones, prominent Nigerians, people outside this country who have died from the COVID. We are seeing on a daily basis. It's unfortunate you go to market, like you rightly said, now if you enter the market, a mall, less than 5% of persons use the face mask. The rest moves about as if nothing is happening. I want to say the effort of the government has not declined. The government is still doing a lot in sensitizing the public, letting the public know. And also from the other aspect of it also, because like you said, why is it that the doom did not come to pass? This is one area that Mr. President, his cabinet, the entire team, our partners in Nigeria from the word go, have put in their very best to see how Nigerians can stay safe, from supporting the technical team that decide on what to do to the Presidential Steering Committee, supporting the NCDC, supporting our agency, NPACDA, providing all we need to get it done. At the time the vaccine was coming up, they supported, made sure that the vaccines came in and everything came in. That effort is there. But it's just that most people just want to believe there's nothing. And I also want to, I know from the very beginning, and even up till today, there are some, apart from the scientific area, what the government is doing, there are still great men and women of God from all religion, Islam, Muslim, Christianity, that are praying for this nation, praying for the world. Let there be peace. And we know from the beginning, as scientists are doing what they are doing, God also has a role to play in the health of men. And I know as the government is working very hard, there are people that are also praying for this nation and the world. And I'm happy that the prediction did not come as was predicted about Nigeria, that people will just be falling and dying. I want to advise our Nigerians, citizens, let's not take this thing for granted. And we shouldn't take the grace of God for granted and disobey. There are basic things we need to do. We are said, if you're in public place, use face mask. Frequently wash your hand, use hand sanitizer. But we see a lot still don't want to do that. If talking about the health system, I will say from the other way, instead the health system has improved because a lot has happened in the health space. We've had many hospitals being opened up. We've had equipment being provided. We've had the cold chain system of the country being improved. The communication system, we have more of integration of services from the underlying ministries, MDAs, more than what was not happening before. We have the health budget better than what it was. Here in the country now, we have oxygen plants everywhere. We also, like heard before, we have moved from 3 labs to over 100 labs in the country. So the health system has instead improved. And if you come back to the cold chain, like from our agency side, before we did not have the ultra cold chain equipment in the country. There's no state in the country now that doesn't have ultra cold chain equipment to store our vaccines. So, and a lot has happened through the opportunity provided from the COVID pandemic that the health system has been improved. And I want to advise Nigerians, for those that think COVID is not real, please, they should rethink. You see, I'll bring in here example of what happened in India. Indians had the same perception we are having in Nigeria. There's no COVID, there's nothing. Until the Delta variant entered India. In a day, they were dying over 200,000 persons. Over 2 million cases were being positive. We had the Delta variant in Nigeria. It was not that disastrous. And as far as the immunization is low in the country, we don't have up to 70% and above persons being vaccinated in Nigeria to achieve herd immunity. We don't know of a variant that will come that might sweep off our feet like it did in India. Once the herd immunity is not achieved, the possibility of catching the infection is there, the possibility of mutations of the virus is there. But once that is achieved, it stops transmission, it stops mutation of viruses, and the community is safe. And that's why we advise Nigerians, let's not take the grace of God for granted. Let's not take the effort of the government for granted. Let's do what is needful of us. Get vaccinated, achieve herd immunity, stop the transmission of the virus in Nigeria. And then, even if there are mutations, it will not be, we will not experience it. The effect and impact from the disease itself will be far reduced in the country, and the economy will begin to improve, and we face other areas of life.
Dr. Kusan, thank you very much. I'm sure we all experience it. You go to social gatherings and people are backslapping and shaking hands. When you want to give a fist bump, say, "Oh, forget Corona has gone." I'm sure we all experience it, and you have to wash your hands, several times. I just wondering, in terms of vaccination, where are we? We know that vaccine nationalism was one of the issues that came up. It was couched in that elegant phrase of vaccine nationalism because poorer nations or developing countries were being denied access to the vaccines, while the developed nations that developed the vaccines were bent on, of course, vaccinating their people and getting herd immunity for their people. So where are we in terms of numbers of vaccinated Nigerians?
As of today, about 16,910,000 Nigerians have received their first dose. Another 8,112,000 their second dose for other vaccines. Now we have introduced J&J. For the fully vaccinated Nigerians, about 8,442,000 have been fully vaccinated. Now, when you look at all, and then for booster, about 696,904 persons have received their booster. All of them short of 27 million jabs being given in Nigeria as at today. And sometimes I would just wonder, all those skeptics that will say, once you receive the COVID-19 vaccine, you will start dancing samba, you will fall and die, all sorts of things will happen. Where are they? We have given about 27 million jabs as at today. None of those things have happened. It's unfortunate you hear some beginning to say, it's after 2 years, some people will begin to die. There's a popular saying, if Friday that will be good, you start seeing it from Wednesday. We have 1 year into vaccination now, another 1 year remaining. So if there are things that would affect, we will start seeing effects. But people just want to say bad about the vaccination. A lot of Nigerians, about 12 million jabs have been given. The vaccines are safe, effective, and we are seeing results from those who have received the vaccine. Because, for instance, I know you asked earlier, though the information did not come. As of today, from NCDC side, the number of persons that have been confirmed officially in the lab is about 254,560 persons, with 3,142 deaths. If you look at those people that have died, the statistics from NCDC, what is showing is that 92% of them didn't take the vaccine at all. The remaining proportion are those from comorbid and so on, and also who did not complete their doses yet. So what this means is that if we refuse to take the vaccine, we are unnecessarily exposing ourselves to risk. And
Dr. Kusan, take that again before Dr. Motar comes in. Of the fatalities we have officially from coronavirus, about 3,000 or so, 92% of them. Yeah, please, just
yes,
recast
I was saying about 3,142 have died so far from official record from NCDC. 92% of those persons never took a dose of the vaccine. The remaining are among those that have other comorbid conditions, or maybe they don't complete their vaccination yet. So you can see 92% of that population did not take the vaccine. That is a lot of message on its own, that we need to protect ourselves. It's unfortunate, Kingsley and Clay, that even yesterday somebody asked me, why is it that people that still take the vaccine still are tested positive? It means the vaccine is not working. I say it's not true. For simple reason. If you take the vaccine, you come out to the public as mentioned earlier, your face is not covered with your face mask. if there's somebody that is infected and with her, you will get infected. But when you get infected, the scenarios you are going to see is, if you are taking the vaccination, the probable case what you are going to see is you will remain asymptomatic, no sign, no nothing, because your bodies have already developed antibodies. So once it enters the body, the antibodies fight and you come down with no symptoms. But a few that have not yet developed full immunity to the vaccination, maybe they have not received full vaccination with booster yet, might come down with mild fever, mild headache, tiredness, 1-2 days is over. But for those that have not taken, they end up in isolation center. You can liken this to what we see even in measles vaccination for our children. Mm-hmm. If 100 children take measles vaccine today for the first time, 85%, in other words, 85 of the 100 will receive full lifetime immunity. If they are faced with the virus, they will not come down with the measles. They can transmit the virus to other children without coming down. If you give those children a second opportunity, after 6 months, 10 more will develop lifetime immunity. In other words, 95 over 100 now. Then you give them opportunity for a booster, additional 3, 98%. But the difference is that child that received the first dose but did not attain 100% lifetime immunity yet, if that child comes in contact with measles virus at school, public place, while they were playing, the difference is the measles that child will come down with will be mild. The child will be playing, eating, unlike a child that did not take any vaccine.
Okay. Dr. Kusan, sorry, we're pressed for time. Dr. Mukhtar Muhammad, it's good that we have grown our healthcare response system, facilities, and equipment. One major challenge that we face with us is maintenance. What measures are in place to superintend this equipment so that 6 months' time, 1 year from now, you go there, you say, oh, no, this one has broken down. Oh, the other one is not working, X, Y, Z, new budgetary lines and all that. We don't know when the next health challenge might arise, so that we have to have these facilities at peak condition. What is the mechanism for ensuring that proper maintenance takes place?
So certainly this is a culture that needs to be built, and it will take time. It is not something that you just wake up overnight and you say that, bam, you have installed an equipment and then everybody is going to use it. It's not that during the planning or in the early 80s, all of the hospitals that were built, most of them had their oxygen centralized supply system. But because of the lack of maintenance culture, over time, they deteriorated, and the equipment became dilapidated as well. So the maintenance culture has to be built. Yes, we have made some progress, but I will not put it that we have reached the end to say that our hospitals are good, things are working. No, it is not so. We still need to have this Marshall Plan, like 10-year plan, to ensure that we mobilize the health system adequately. We build the culture of maintenance, and that is through training, having partnerships with technological firms, and also ensuring regular servicing and maintenance. That is the culture that we need to build. Regarding COVID-19, yes, COVID-19 is an opportunity for us to invest a lot in the health system, which is currently going on. But still, a lot need to be done. And certainly everyone has a responsibility, from the government and the people as well, to ensure that we build and sustain these systems.
Dr. Mukhtar Mohammed, I'm sorry, I have to interject here. We're almost hitting 9 o'clock, which is our time. So I'd like to appreciate you, for the points that you have given us. Dr. Mukhtar Mohammed is the head technical secretariat, Presidential Steering Committee on COVID-19. I also like to appreciate Dr. Basi Okbose, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Dr. Okbose, thank you very much for joining us. Earlier on we had, of course, Dr. Ifedayo Adetifa and Vivian Quarre. And that's it on Good Morning Nigeria for today. Thank you, as always, for joining us in our conversation. We do appreciate it if you join us again tomorrow. And also join us in our fight against rape and trafficking. I am Claire Adilabu Abdulrazak.
I am Kingsley El Sadallah. Have a nice day.